What are the prednisone side effects in women? Hi, I'm Dr. Megan, the Prednisone Pharmacist. I'm here to talk about the 3 P's of prednisone side effects in women, from period to pregnancy to post-menopausal, and all sorts of things in between. First, I'm going to talk about women's specific issues that might change because of exposure to prednisone, and then I'm going to talk about specific side effects that might be worse because you're a woman, statistically speaking. So first, let's talk about periods. I made a whole YouTube video going in depth in all the most frequently asked questions about what prednisone does to a woman's menstrual cycle. And the short answer is it can pretty much do anything. It can make you stop having a period, amenorrhea. It can cause dysmenorrhea, which is painful or prolonged heavy bleeding. And it can cause post-menopausal bleeding. So any change that you were not expecting to your period is possible, but it's not super common. So if you want to know more about prednisone and periods, watch my video all about it. Next, let's talk about women's breasts. So this one isn't commonly studied in the literature, but support groups do mention this. Women post saying, has anyone noticed this or this? And essentially, people have noticed that you can either have bigger breasts than usual because of the prednisone weight gain, smaller breasts than usual because of the fat redistribution, or tender, or breasts that you are just miserable around. So that leads me to pregnancy. Is prednisone safe to take while pregnant? Now, this is a tricky question because there are 2 people in this equation. There's the mama and there's the baby. And if mama is sick enough to need prednisone, what is the effect on the baby? So there's 2 factors to consider here. What if the mom doesn't get treated? Okay, so let's say a mama has asthma that is so bad she's not breathing properly. And so her oxygen level in her blood that she's sharing with her baby through the placenta isn't adequate. So now the baby is suffering with low oxygen. Does it make sense for the mama to take prednisone and not have the breathing problems? Yes. The damage from the low oxygen is likely worse than whatever perceived or potential damage that could be caused by prednisone. In fact, the doctors who take care of mamas, called obstetricians, they have a society called the American College of Obstetricians and Gynecologists. And they put out an official document saying that if a woman needs prednisone, then she should get it, that it is worth it. The benefit of treatment is greater than the risk of side effects to the infant. And then there is a little tiny risk for cleft palate if taken in early pregnancy that has not been shown to be backed up by recent studies. And so while it may cause an increased risk for cleft palate, it's actually not likely to happen and is probably not more likely than just the general population of women. So if it were me being prescribed prednisone while pregnant, I would definitely take it, because if the benefits of treatment outweigh the risks for you, then it's worth it. So that's pregnancy, that generally it is worth it. Does it have effects on the baby? Yes. But are the effects of being untreated worse? Probably in most cases. So you definitely have to talk to all of your doctors in your care team about it, make sure it's right for you. So that leads us to after the baby's born, breastfeeding. This is something I personally had to deal with. I took prednisone, my very first dose, when my baby was 9 months old and was still breastfeeding. And I had breastfed all of my babies past 1 year and was planning to do that with this child as well. And then I was given prednisone and I was in the hospital, and I had no desire to be taking prednisone, but once I realized I had to take it and that I was breastfeeding, I looked up this drug in the LactMed app that I highly recommend all breastfeeding women use to look up any medication or herb you might want to take while breastfeeding to see if it's compatible. And I saw some information, and the first said that it's generally safe for the mother and the baby to use while breastfeeding. I was like, great, that is wonderful. So my nurses supported me miraculously getting the milk to my baby, pulling lots of strings for me, and it was a really big blessing. But I neglected to realize the second line of their publication that says that there may be a decreased milk supply. And that hit me hard. I personally completely ran out of milk. 0 after about 2 weeks after my first dose of prednisone. And so there was nothing I could give, so I had to stop nursing. There was literally no way I could continue breastfeeding. So I had to switch my little baby over to bottle feeding, and it really broke my heart. But I would have continued had I been able to, even through the rest of the 9 months that I spent taking prednisone, if it had been a possibility for me. It just wasn't in my situation. So both the doctors who support mamas who are pregnant and the doctors who support the babies that need to be breastfed, all of them agree that the mother should be treated with prednisone if it's required, that the benefit of treatment is greater than the risk of side effects to the baby. So that's pretty reassuring that all of the doctors are in agreement that treatment is better than non-treatment. Now, we talked about periods, pregnancy, now post-menopausal. So prednisone is mimicking your body's hormone called cortisol. And cortisol is a member of the steroid hormones. And some of the steroid hormones you might be familiar with if you are a woman who is post-menopausal, because these include estrogen, progesterone, testosterone, and many others. They are all structurally related, and there are a cascade of changes that can happen in your uterus, in a woman's placenta if she's pregnant, and other places in the body where one can switch to the other and back and forth to intermediate things. And sometimes this cascade of hormones can be disrupted, leading to weird hormonal changes. So normally your cortisol is at a certain level, but if you have lots of stress, for example, if there's a famine or a war or you run a marathon, those things really cause the cortisol to go really high. And in super athletic women, they often lose their periods, have trouble with fertility and things like that because of all of these changes that high cortisol can have on progesterone, estrogen, testosterone, and other sex hormones. And so when it comes to being postmenopausal, that means while your hormones might have finally equaled out, now you might have postmenopausal bleeding, and it's not fun, but likely after stabilization of your dose or going off of prednisone, it should stop. And if not, definitely talk to your doctor. There are things you can do. In addition, if you're like me and not postmenopausal, you can suddenly feel postmenopausal. So when I was taking high doses, I felt like a woman who was going through the perimenopausal changes. I had hot flashes, I had night sweats, I had emotional changes. I felt like the stereotypical menopausal woman, and it was not fun. I had flushing of my cheeks and chin. I would just suddenly, out of nowhere, everyone else in the room is feeling just fine, and I'm flushed, hot, sweaty. And I thought, well, I guess now I know what it's going to feel like in 10 or 20 or 30 years, however long it is for me. And it was a surprise, and it's not just me. It's a common side effect that is often experienced by non-postmenopausal females. And even women who've already gone through the change can suddenly feel like they're going through the change again. Now back to the fact that prednisone is mimicking these other steroid hormones and affecting their cascade. One of them I've mentioned a few times is testosterone. Now testosterone we think of as a male hormone, that men have really high testosterone, and that's why they can have strong muscles and grow facial hair and have deep voices, all the things that make them men, right? Well, prednisone can affect your hair. It can. Some women will report peach fuzz or having to shave for the first time ever in their lives on their faces, or the hairline going down, or their hairline receding. Men will report hairline receding and having it not return. And others, like me, will experience hair loss that is not the typical chemotherapy hair loss where they're locks of hair, like you find them in your bed or wherever. It's more of hair thinning, hair fall. And this is because of these changes in hormones, or it could be a stress-induced type of thing. That prednisone is your stress hormone, and it can cause a change in the level of the hair cycle. The telogen phase of your hair cycle can be disrupted and suddenly cause hair fall. And that is what happened to me, not during prednisone, but several months after I started losing massive amounts of hair. And I have very thick hair generally, and I lost about 1/3 of my hair. For me, that made my hair actually just the right perfect thickness. But for most people, that is really disturbing. And so it was June when I stopped taking prednisone, about August when I started noticing the hair fall, October-ish when it stopped, and then in about Christmas, just January-ish, I started noticing little hair, like thickness across my scalp. I could see, oh, like I have a lock of hair growing. It was this long and this long, and I had this cute little curl at one point. And so the hair growth happened eventually. It was about 6 months or more after that I really noticed it happening. So if you're having hair fall, it does go away, but it is real and it's not fun. Now, there are other steroid side effects that you do not want to experience, but can definitely happen and are more likely in women than in men. So a common type of prednisone side effect that is different in women than men is psychiatric side effects. So prednisone can change your mood and change your emotions, change your mental health. And it is more common in women than in men, unfortunately. A man might have a really positive experience with prednisone and be like, I didn't have any side effects. Whereas often women will. In fact, it's rare if a woman takes prednisone and doesn't have a side effect. Specifically, depression is more common in women than in men. Whereas in males, mania and delirium are more common. And if you're having these mood changes, remember, it's not you, it's the drug. And there are things you can do. Tell your doctor, stay in close contact with your doctor. Let them know that you're experiencing these side effects so that they can help you. And I want to conclude with the most important one for you to pay attention to. The difference between men and women on prednisone that is most concerning is bone loss. Now, everyone taking prednisone will have some degree of bone loss. And the shorter amount of time you take it, the less bone loss. But the highest percentage loss of bone mass is during the first 3 months of treatment and continues thereafter at a rate of 10% per year. And it is most common to turn into osteoporosis and full-blown bone loss disease in postmenopausal women. And so if you are a woman who's postmenopausal, who is lower weight, who is of Asian or white European descent, you are at very high risk for osteoporosis and fractures and loss of height, your spine collapsing upon itself, called compression fractures. And those broken bones, you can't even feel the compression fractures until they've happened. And usually the only way you know is you're shorter. That's the only way you can realize it's happening. And so you need to be taking precautions. And the doctors who prescribe prednisone the most are specifically most worried about postmenopausal women taking prednisone for more than 3 months. And they have a whole list of guidelines, and I'll cover just a few of those right now. First, they want you to prioritize all the things that you need to do to decrease your risk for osteoporosis, like quitting smoking, not drinking, getting good exercise, keeping a healthy weight, not necessarily losing, because if you're low weight, we don't want you losing any more weight. Keeping it a BMI between 20 and 25. And then getting the nutrients you need, such as calcium and vitamin D. But it's not just those two. It's also vitamin K2 and magnesium, potassium and protein and collagen, all of these really important nutrients that you need. If you want to know how to counteract these side effects and many more, I have a Prednisone checklist I encourage you to download. It's completely free. You just put in your email and I'll send it right to you. Just click the link below and you can know how to counteract the side effects I've talked about today to minimize your risk for complications that can be irreversible. Just click the link below, fill out the Prednisone checklist form, and I'll send it right to you. Signing off as Dr. Megan, your prednisone pharmacist.